Over the weekend, comedian and actor Bernie Mac passed away at the age of 50. The funny man suffered from a disease called sarcoidosis. How'd I do, doctor?
Good.
All right, good. But even scarier, it was reported he died of complications from pneumonia. So just how common are deaths from pneumonia, and what does that have to do with the disease that he carried?
Dr. Jake Deutsch is from the Hackensack University Medical Center in New Jersey. Good to see you, Dr. Deutsch.
Good to see you.
All right, so Bernie Mac had sarcoidosis.
Sarcoidosis.
Which is actually, it has something to do with the lungs, right?
Right. It's an immune system disorder, causes inflammation of the lymph nodes. Those are the parts of our body that help fight infection, and it's particularly found in the lungs. So primary lung problems are the result of it.
But it had been in remission, right?
Yeah, they have a period of remission, and then sometimes it becomes active. Tens of thousands of Americans suffer from sarcoidosis. Many people have disease that doesn't affect them at all. Other times people have severe disease that can be debilitating, cause respiratory problems that are very chronic.
Is it accurate when we read reports, like everybody's reading today, that one had nothing to do with the other?
Well, that's what has been reported. It's difficult to say not having taken care of them. I mean, I think if you have a chronic lung disease and you get pneumonia, which is a lung problem as well, when you get an infection in your lungs, it certainly would complicate the picture. Anytime somebody gets pneumonia, they have chronic medical problems, they're elderly, they're immunosuppressed. That makes getting better from pneumonia very difficult.
So Brian was just mentioning in the commercial break that he saw Bernie Mac out in public just 3 weeks ago.
He gave Barack Obama an introduction the other day. It was colorful, and Barack Obama had to say, listen, you had to tone it down. You had to hurt me there.
Yeah, he was always a very funny and colorful person. So I think this is an excellent example of how illness can rapidly progress. When people get an infection and it becomes in their bloodstream, it can cause very serious life-threatening problems that can be fatal and happen in a short period of time.
Because so many times we hear about people who have cancer or, you know, some other disease, and then officially they die from pneumonia.
Sure. It's often a complicating factor. Just going into the hospital puts you at risk for pneumonia. So it is something that is got to be taken seriously, but also keep in mind thousands of people are treated every year as an outpatient with pneumonia. They get antibiotics, they see their doctor, and they get better. So it's something you want to always be worried about, but I wouldn't lose sleep necessarily over.
Sarcoidosis. Do you inherit that? Do you acquire that? How do you get that?
It's one of those diseases we don't have a clear explanation of the cause. There is thought to be a genetic property to it. So some people will receive it from the genes that they have from their family. But environmental causes are thought to be a big part of it, too. So exposure to dust and certain things in the environment that are irritating to the lung, our body naturally tries to fight infection, and that may precipitate sarcoidosis.
You work in the emergency room, emergency medicine. How long does it take you to calm down at night when you get home?
Well, I got home at about 1 a.m., and I got up to come here, so it didn't take too long. Cup of coffee, and I'm good to go.
And a hot shower.
Yeah.
Hey, Steve, hot shower or cold shower this morning?
I'm sorry, what was that, Brian?
Hot shower or cold shower this morning?
It was, luckily it was a hot shower. Why do you care?
Can I ask you a question?
Because he was asking the doctor how he does his very highly stressful job.
Did you ask the doctor whether or not he had a hot shower?
No, he was just saying that he works in the ER, and obviously it's a very stressful situation.
Right. Brian, when was the last time you had a cold shower?
He needs one now.
Yeah, okay, good point. All right,